Welcome to episode 5 of Going Mental, which we talk about a topic that is rather controversial, medication. Now, I'm going to start, Kristy is going to listen, and I think she's going to have some things to say about this, because we don't quite agree. Medication saved me. That's the short version of my story. For a very long time, I was a psychology student. I tried any number of talking cures. I was in group therapy when I was 19 at university. And eventually, at the age of 43, I was diagnosed with bipolar type 2. I was flabbergasted. One of the greatest fears of my life was that I was touched by depression like Mum, but I never imagined I had fairly much the same condition as her. It took me 25 years to get the diagnosis, at least, but it only took about a month to find the right medication for me. I take 2 medications at the moment. One is an antidepressant, the other is called an antipsychotic, even though I don't have psychotic symptoms. And the 2 of them working together cover about 90% of my symptoms, which is about as close as I think as I'll ever get to having the bipolar under control. And I am absolutely delighted. I feel peaceful. I don't have stress all the time. Kristy doesn't see medication quite that way though.
First I want to ask, do you have any side effects from your medications, Andrew?
Absolutely none. It is all good.
My personal experiences I had when I was first diagnosed, I had very bad experience with SSRIs. They're a type of antidepressant. If I had taken the doctor's orders and stayed on SSRIs, I have no doubt that I wouldn't be here today. SSRIs made me suicidal. Okay,
Kristy, you do need to be a bit more specific about this. You tried a number of different ones, but you don't know which ones they were.
I don't know because I was in a haze at the time. I was too unwell to know what medications the doctors were putting me on. Also with SSRIs, they usually take at least 4 weeks to work.
Yes, they have what's called a long latency period. You don't take them with effect. They take a while to start working.
But the doctors were moving me from one to another in a week, so not giving any of them a chance to work in the beginning thing.
Yes. That could be a problem.
Eventually I got really sick after 2 suicide attempts, and talk about changing my medications.
Can you slow down a bit? 2 suicide attempts?
Okay, I had 2 overdoses. My parents took me to Mounsey Hospital. I didn't need to get my stomach pumped, thankfully. I had to drink charcoal. One time I called the ambulance, the other time my parents took me. I didn't get readmitted to the psych hospital because the nurses were well aware that my mother was the best person to take care of me at the time.
Do you remember why you tried to commit suicide? Was there any particular reason?
The only time that I felt suicidal was on SSRIs. One time I'd had a really good day, and then I took the overdose that my parents took me to the hospital from because I never thought I'd have another good day. I thought that my life would never get better. That type of pessimistic thinking was, I believe, well, I had depression beforehand. I don't think my depression has ever been that bad without SSRIs. I do believe that the SSRIs were the thing that made the depression to the point where it was suicidal. They say 1 in 600 people on SSRIs kill themselves who otherwise would not kill themselves. So after that experience...
Kristy has reason to believe that she is that 1 in 600,
yeah.
Based on the experiences, is that right?
Yes. And I was very lucky because I had my parents' support. Eventually I got to the point where the doctors didn't know what to do. They were talking about putting me on lithium, which is a drug that works for many, many people with bipolar, but it scared me because it can have some very serious side effects.
It's highly toxic. You have to have your blood tests every month, is it? At least every 3 months.
I'm not sure for
Toxicity.
that one, but I know for other medications you have to have your blood tested monthly. I don't know for lithium, but hearing the words lithium was a big wake up for me. I took myself
It's seriously scary. So.
I took myself off everything, and I was ill in bed, mostly hardly left the house for about a year. The blessing for me with bipolar is time can be a healer, and after that year I was back to what I was used to as normal. I now see that I had always lived with high levels of anxiety. I went without medications for another 4 years after that, so I was medication free.
Which was the year when you had all the problems and then you went off? How far back was that?
I was 23 at the time, and it took me about a year, about 24, to get to the point where I was again well and functioning. I was a functioning member of society.
So this was about a year after your admittance to the psych ward, a year or two during that period.
I'd say I wasn't well again until I was 24, but there was a transition period where I was getting well. So I was starting to do more and that sort of thing. Then I had no symptoms, no problems for another 4 years, except that I couldn't get work. I eventually, after trying a few jobs, I eventually went back to teaching. I went back to university to try and do my master's in primary school teaching. I became unwell again, and I chose to go back to my doctor, and he put me on an antipsychotic, and that's when I was hallucinating about head loss. He put me on an antipsychotic and a mood stabiliser. I liked that particular mood stabiliser, and I stayed on that for a number of years. I went off the antipsychotic, stayed on the mood stabiliser. What was the best thing for me is that I have a wonderful GP who allowed me, within the confines of his knowledge, to experiment myself to find the right doses of my medication, that sort of thing.
That's what I did too, because I was voluntary. And I said that I had no side effects. I had one side effect initially. I was taking initially a high dose of an antipsychotic, which was, for me, it was working as a mood stabiliser and a sleeping tablet. But on the initial doses, I was getting fat. I put on about 20 kilos. I was quite concerned about that. So the one adjustment that I made, and many antipsychotic medications have weight gain as a side effect. I cut down on the dose. I experimented on how much to take, and I would tell my psychiatrist, no, I've changed it to this dosage, and he would just say, okay. And I was allowed to do that, and I found within a few months, I did a couple of adjustments, but within a few months I got it back to where weight gain wasn't a problem. I'm now at the stage where I think I'm the same weight as I started when I started on the medication 10 years ago. I'm even a little bit lighter. So it is possible to experiment and to try things out.
I think it's really about being well enough and having a doctor that trusts you and that you trust, and working out the medication situation for you. But I would always argue that especially somebody with side effects, and there are other reasons too, that I argue that a person, unless they're a danger to themselves or others, should have the legal right to be medication free. For me, I am 50 kilos heavier than when I was first diagnosed with bipolar. I've had some other health issues that contributed to that, but medication, it wasn't as simple as I went off the medication and I lost the weight. No.
Weight loss is never that simple.
No. On top, but it did come on that fast. Within 6 months I'd put on 30 kilos. Okay, and it wasn't what I was eating. Although I wasn't eating all that healthy, I'd never experienced any weight gain before that. They affected my metabolism. I'd also argue that some of the worst side effects are people who are sedated by their medication to the point where they can't function. Another issue is that some people find on medication their creativity is diminished.
Not only their creativity, nearly everything can be diminished by sedative or by, like I said, depressant medication.
Sexual function is often inhibited, especially in men.
For antidepressants, that's a notorious side effect. That you can lose your sex drive, you can become impotent, scary stuff. There are some seriously scary reasons why some people do not like their medication.
They can have roles in liver toxicity. It's because of these things that I argue, as I do with actually anything to do with the body, about informed consent, not lying to patients. I've heard it from a psych nurse saying, oh, we never tell patients that their medication will put on weight. And I feel that's deceptive. That's not the same as treating you as a human being with rights. I believe in the sanctity of the body. I consider myself a feminist. I consider that every human being should have the right to choose what is put in their body. And that's these are the reasons that I think I advocate the choice in mental health medications. And although I choose to take medication at the moment, I had also stopped medication for a few years recently when I was trying to conceive a baby, because the medication I had been on caused fetal brain damage. And I will make an excellent mother one of these days when I finally fall pregnant. So I advocate for people with mental illness having the right to choose whether they have children or not. And that is,
and we will certainly be doing another podcast or maybe even a series on that.
And
reproductive rights.
Tell us what you think. But all of that means that I advocate for the fact that we need informed consent, not just consent, for any medication. And I think we'll probably do another episode on shock treatment. Okay? It's not good enough to say somebody can sign their rights away. We need informed consent. We need doctors that trust us as well as we trust them to tell us what the medication can do. And we need, I think especially, we need access to therapists, whether they be psychologists, hypnotherapists, art therapists.
This is a very long wish list. We know this. This is not going to be easy, but these are all live issues that we believe at least need to be discussed in an open and rational manner, which is sometimes quite difficult to do in a problematic area like mental illness.
Often people come down on the side either anti-psychiatric medications or pro-psychiatry, and believing that everybody with a mental illness needs psychiatry medications. What I'm advocating...
In some cases it's true, but in many cases there's a mixture of the two in between. That's probable, so that we have black, we have white, but a considerable area of grey in between. We're talking about the area of grey here.
Yeah, I can't rationally believe that we have any right to tell another human being what can and can't be in their body, be it medication or sex. I can't...
We can have other discussions about this one, because Kristy and I don't quite agree on that either.
Andrew, I think Andrew would say that he falls in the pro-medication camp. Is that true?
I am a convert to medication. I've spent most of my life stridently campaigning against psychiatric medicine. But I have been, I hate this phrase, mugged by reality. I found that I had a condition which was strongly genetic, in that my mother and my grandmother definitely had it, and that medication is really the only thing that could possibly have any solid, reliable effect. Medication has saved me, there is no doubt.
During the 11 years, 12 years or so that I've had my diagnosis of bipolar, I have spent at least 7 of those years with no medication at all, because for 2 of the years or so I was trying to fall pregnant, hoping to fall pregnant, and the other 5 years was because I had such a nasty incident with SSRIs.
For that reason, Kristy is now not taking antidepressant medication. Now, we have had long conversations about this. I have told her that her condition will never be stable until she tackles that. But because of her experiences, it is still too hard, literally frightens her to death to even think about it.
For me, antidepressant medication means I might not be with my parents, my friends, my partner. I could seriously be dead. And there might be one out there that would work wonderfully for me, but until I have the exact name for it and a guarantee, I don't even want to try. I'm on a antipsychotic at the moment. A big issue for me is that there is no mood stabiliser that is safe to take throughout pregnancy. And I never thought it would take this long to get pregnant, but me and my partner are having issues, other health issues, and I'll talk to that in an upcoming podcast, one that I do on my own without Andrew. And so I think there's a lot of controversy even between us who are very, very good friends, and I think that there's other people who are much more on one or the other side, and we want to hear from you, and we might disagree with you, but I really think that...
We'll come up with good reasons for disagreeing.
Yes, and one of the reasons me and Andrew wanted to start these podcasts is because how important it is that we talk about these things and we discuss them.
We have discussions and we argue things and we agree on areas to disagree on.
Yes.
Tell us what you think. I'm sure you will have opinions on this subject.
So that's all for this episode. Signing off. Thank you very much. Bye.